Hello viewers, me Dr. Sanjay Prasad Gupta, a gynecologist. Today's topic of discussion is preconceptional counseling. That is the counseling which has to be given before getting pregnant. Now the pregnancy and childbirth are major life events. The aim of preconception care is to promote health of a woman before conception in order to reduce preventable adverse pregnancy outcomes by facilitating risk screening, health promotion, and effective intervention as part of routine health care. Now, similarly, interconceptional care is defined as the care provided between delivery and the beginning of woman's next pregnancy. During the interconception period, intensive interventions are provided to women who had a previous pregnancy that had ended in an adverse outcome, such as fetal loss, preterm birth, low birth weight baby, baby with birth defects, and infant death. Now, why we need preconception care? Increasing evidence suggests that human health status in adulthood is determined by microenvironment inside the uterus and macroenvironment conditions around the woman at the time of conception. That is called fetal programming of adult disease. Hence, the first prenatal visit may be too late to address the modifiable behaviors that could optimize not only pregnancy outcome but also the health of the child and the adult. Parents, patients coming for conception are often too late for modifiable behaviors or therapeutic interventions to prevent developmental abnormalities or mitigate the risk. Almost half of the pregnancies are mistimed, unplanned, or potentially unwanted. Hence, the importance of preconceptional care is very high. This is particularly true in case of adolescents, recent migrants, and disadvantaged women. Similarly, the proportion of women who delay their child bearing or get pregnant with significant medical conditions are increasing, and specific opportunities exist to optimize their fertility. Finally, 82% of the reproductive age women, that is 18 to 44, had a healthcare visit within a year before they get pregnant, which suggests significant opportunity to provide preconceptional counseling, yet this is not being done. So all healthcare providers, including but not limited to nutritionists, pharmacists, nurses, midwives, physicians, of course, obstetrics and gynecologists should integrate preconceptional care in their routine checkup. So, before prescribing or before giving any advice, two questions must be asked to a woman. Are you pregnant? If yes, then take the history, risk factors, and interventions to keep the pregnancy safe. If you are not pregnant, then what are the precautions you are taking not to get pregnancy? What is your reproductive plan? And reproductive life plans should be individualized and addressed in visits at menarche, reproductive age, and any subsequent health encounters by all care providers. If conception is not anticipated, then contraception should be discussed. If there are specific conditions which contraindicates pregnancy, then also contraception should be advised. Now, what are the counselings regarding what factors we should counsel before conception? The most important is the maternal age. The ideal age to get pregnancy is 20 to 34 years of age, not before 20 and not be after 35. If they are elderly, then there is increased chance of miscarriage, fetal loss, infertility, and its treatment with its consequences. Increased risk of diabetes, increased risk of preeclampsia, increased risk of preterm birth. All these increases as the maternal age increases. Similarly, for the fetus also, there is increased chance of preterm birth, if fetal growth retardation, aneuploidy in the fetus. All these increases as the mother goes older. So, before 35, the mother should get pregnant. And regarding the teenage, that is before 20, there is a competition between the mother and the fetus for the nutrients. There is increased chance of preeclampsia, eclampsia, depression in the mother, post-traumatic stress disorder, sexually transmitted infections, and mostly the teenage pregnancies are unplanned and unwanted. So, the conclusion is all teenagers should receive sex education, family planning counseling, and contraceptive services to avoid teenage pregnancy. Similarly, the paternal age is also important, especially if they are above 45 years of age, because there is increased risk of autosomal dominant disorders, structural chromosomal disorders, complex neuropsychiatric conditions, behavioral disorders, cognitive disorders in the child. So, the maternal and the father health both is important before conception. If they are planning for a single child, then they should conceive before 35. And if they are planning for a two child, then the first pregnancy should be before 30 at around 27 to 29 years of age, and the second pregnancy before 35 at around 32 to 34 years of age. Next important thing to consider is body mass index. The normal BMI is 18 to 22.9. If they are overweight, then there is increased chance of neural tube defect, macrosomia, preterm delivery, stillbirth, gestational diabetes, hypertensive disorder, thromboembolic disorder. At the same time, gallbladder disease, hiatus hernia, increased chance of congenital malformation in the baby, increased chance of cesarean delivery, increased chance of wound infection, increased chance of anesthesia complications. So, overweight and obesity should be avoided. And before conception, the BMI should be idealized. Natural modifications are encouraged. Target is slow, steady weight loss preconception by dieting or exercise. Because once you get pregnant, weight loss is not recommended. Similarly, if the mother is obese, there is increased chance of childhood obesity in the baby, metabolic complications of the baby when they grow old. During adulthood, there is attention deficit disorder in the baby. So, metabolic obesity, maternal obesity create a metabolic environment in and around the fetus, and the fetus is susceptible to allergic and non-communicable diseases in the future, such as asthma, type 2 diabetes, childhood obesity. So, maternal obesity should be avoided. Similarly, the underweight has got its own problem. There is increased chance of miscarriage, preterm birth, FGR, hypertensive disorders. So, the underweight should also is not wanted. Now, the next topic should be regarding infection and immunization. Sexually transmitted infections such as syphilis, HIV, hepatitis B should be ruled out. The test should be done, and the targeted test should be done in high risk individuals for chlamydia, gonorrhea, tuberculosis, toxoplasmosis. These are the target infections. If they are HIV positive, then they should use contraceptions till the viral load is suppressed below undetectable level. They can be considered for ART to reduce the paternal fetal transmissions of the HIV. They should be they should have a torch testing to, and they should be checked whether they are susceptible to toxoplasma, whether they are susceptible to cytomegalovirus, whether they are susceptible to recurrent herpes, whether they are susceptible to rubella. So, if they are susceptible to rubella, then before conception, MMR or anti-rubella vaccine has to be taken, and following any live vaccine, there should be a gap of 3 months before conceiving. Similarly, if they are susceptible to toxoplasma, then they should avoid playing with cats. Raw and uncooked meat they should avoid, and then they should avoid also the raw vegetables, or it should be washed well before eating. Similarly, if they are susceptible to cytomegalovirus, especially the child caregivers, then they should maintain health hygiene. And if they are susceptible to herpes or recurrent herpes, then they should have a suppressive antiviral treatment, especially in the 3rd trimester. And if there is active lesions during the time of delivery, then caesarean delivery has to be considered. So, immunization has to be given before conception for rubella, if possible for hepatitis B, and also for the varicella zoster susceptible woman. And after pregnancy, they should be given DPT vaccination around 27 to 34 weeks, and in the flu season, flu vaccine. And at the same time, human papilloma vaccine should also be discussed, if not given conceptionally, post-conception to be given or to be considered for the prevention of cervical cancer. Now, the next topic is nutrition. Nutrition is equally important. Around 300 kilocalories above the average should be used as an energy source, especially in the 2nd and 3rd trimester. Omega-3 fatty acids are recommended, 200 to 300 milligram per day. 1 to 2 servings of fish per week is enough for that. Similarly, vitamin D should be checked. If they are deficient or insufficient, then they should be treated for that. Iron should be given in iron deficient women if they are anemic. And most importantly, all women should be given folic acid before conception, and the normal dose is 400 to 800 microgram, not more than that. No folic acid 5 milligram, it is 400 to 800 microgram per day. So if you are eating folic acid 5 milligram, this is excess. Better you go with weekly dose of folic acid in that case. But if there is history of neural tube defect, then you should take 4 milligram per day. Similarly, if there is family history of NTD, if there is personal history of neural tube defect, if the mother is suffering from diabetes, if the mother is having anti-seizure drugs, then they can take 4 milligram folic acid at supplementation. Similarly, if they are iron deficient, then they should get elemental iron also. The usual dose is 45 milligram per day. Similarly, if they are calcium deficient, then they should be given calcium supplement, and after pregnancy all should have supplementation with iron and calcium. Similarly, zinc, iodine is equally important, and that should be checked whether it is available in the diet or not. So, nutrition is equally important. Caffeine should be restricted less than 200 milligram per day. Now, the next important thing is genetic screening should be done. If there is any genetic disease they are suffering from, if there is a history of congenital malformations in the family, or if there is any familial disease with having a genetic component, then they should be screened for the genetic disease also, especially hemoglobinopathies such as thalassemia and sickle cell disease. And if at all they are suffering from some genetic disease, so there are options. They can be considered for donor eggs, donor sperms, assisted reproductive technology, and before implantation, pre-implantation genetic diagnosis. All these has to be considered before conception if they are susceptible to genetic diseases. Similarly, substance abuse and tobacco hazards should be considered and they should be avoided. Smoking and alcohol all increases risk of IUGR, birth defects, altered neuropsychology in the child, behavioral risk, IUGR, preterm birth. So, there is sudden infant death syndrome, cognitive defects in the child. So, no smoking and no amount of alcohol consumption is found to be safe in pregnancy or preconception period. Similarly, cannabis, cocaine, avoid amphetamines and other recreational drugs should be avoided. Environmental exposures of mercury, lead, pesticides, bisphenol A, polychlorinated compounds, they should be avoided. So, fish giving lot amount of mercury should be avoided. So, these are very important during the time of conception. Similarly, the medical conditions has to be checked before going for pregnancy, such as the diabetes mellitus. If they are diabetic, then the sugar should be in the optimal range, in the normal range. If they are having thyroid disorders, so they should be in the normal range, whether it is hypothyroid or hyperthyroid. If they are hyperthyroid, then better to go with propylthiouracil in the first trimester to avoid birth defects. If they are having epilepsy, then better to go with monotherapy, and the safer drugs are lamotrigine, carbamazepine and levetiracetam. But if there is no seizures for 2 to 5 years, there is normal neurological examination, normal intelligence, EEG is normal, then medication can be discontinued also before conception. So, the medical history has to be taken and accordingly it has to be optimized. Suppose if they are having cardiovascular disorders, so the drugs to be avoided in pregnancy are warfarin, ACE inhibitors, ARBs. This should not be given. Tetracyclines and aminoglycosides should not be given before conception. They are contraindicated during pregnancy. Other medical disorders such as the liver disorder, renal disorder, asthma, thrombophilia, rheumatic heart disease, ischemic heart disease, all should be considered, checked and optimized. These things are very important before they before they go for pregnancy. Similarly, so finally we have to check, we have to do some investigations before they go for pregnancy. The first investigation is complete blood count. So hemoglobin and the base level WBC count or platelet count has to be checked. If they are anemic, then the cause of anemia has to be determined and it has to be corrected. If there is iron deficiency anemia, then iron has to be given. Similarly, the urine test has to be done. Culture and sensitivity has also should be done to rule out symptomatic bacteriuria. Blood group is very important. Blood group has of the mother has to be checked. If the mother is Rh negative, then father's Rh has to be checked, and if they found father is found to be positive, then indirect Coombs test has to be checked for the mother. Similarly, STI should be ruled out. VDRL test has to be done, HIV has to be done, hepatitis B has to be done, and if it is positive, then the treatment to be considered. Similarly, HPLC for thalassemia screening has to be done to rule out hemoglobinopathies. TSH has to be done to rule out thyroid disorder. Glycated hemoglobin has to be done, which should be before 7, before conception. 25 hydroxy vitamin D has to be considered and it should be done, and if they are deficient or insufficient, then it has to be treated. So these investigations are very important before they embark on pregnancy, and the recommendations is very important. The one which is vitamin D screening has to be done. Folic acid 400 microgram per day has to be given. Iodine supplementation has to be given if required. Vaccinations again, rubella has to be given. So finally, the thing is that simply we just not go for the pregnancy. Before pregnancy, we should have a counseling, and the counseling is important for both the boys, the girls, and of course the couple, so that the mother get a healthy child for an healthy adult in the future. Thank you very much. Thanks for watching. If you like similar type of videos, do subscribe my channel. Jai Hind.